Hello, hi, it's Dr. Onebola. Thank you for joining me on this particular question and answer video. I am going to talk about the otitis media, which is also known as ear infection. So otitis media occurs in the inner ear. There's severe type and there's non-severe type, just depending on the situation, the individual involved, the amount of antibiotic previously used, also whether the patient has fever or not. Diagnosing is dependent upon three criteria, which is again the presence of fluid in the middle ear, also symptoms that the patient may be feeling, like pain, uh, inflammation, tugging of the ear itself. Those are indications that otitis media is present. Bacterial or viral infection is actually present. Okay, so otitis media can be complicated or complex, I should say, and it can just be simple, just depending on the situation. So otitis media, again, can be caused by different factors. I'll go over some of those. And some of those include the presence of uh, bacterial or viral infection in the throat, bacterial or viral infection in the sinuses, bacterial or viral infection in the nose, having runny nose, having cold and flu-like symptoms. Those bacteria and viruses can travel from the area of original location to the earlobe, to the eardrum, to the tympanic membrane inside the ear. Once that occurs and the original infection is not cleared or not cleared properly or not cleared at all, again, those microbes will travel to the inner ear, causing infection or otitis media. Also, there are other risk factors such as presence of a young child in daycare services, presence of a child using bottles to feed when laying down, also the presence of being around other young children at an early age, whether at home or daycare. All of those are risk factors for otitis media. And so, to answer the question, does bottle feeding cause ear infection or otitis media in infants? And the answer is yes. Okay, so the anatomy of a infant or newborn ear is horizontal, not like that of an adult. So there's a direct path from the outer ear to the tympanic membrane. Whereas in adults, the ear canal is at an angle. Okay, now because the anatomy is different, when bottle feeding, that milk or that bottle content can be drained back into the ear, causing a change in pressure, causing a change in the inner ear pressure, as well as milk or contents can actually leak and come out of the child's mouth into the ear itself, the ear canal itself. So, because of that, and because of the anatomy of the child's ear, that is causing ear infection as well. Not the primary reason for ear infection in young kids or infants, but that is one of the causes. Okay, now this can be prevented. It's a known fact that this happens often. It can be, again, prevented by reclining or inclining the infant at a 45-degree angle or at close to 30-degree angle so that the flow of the fluid goes down back into the body instead of down back into the ear. Okay, so once we've actually found that this is the situation, the caregiver or parent can cleanse the ear, cleanse behind the ears, make sure that the child is not experiencing ear pain, experiencing fluid in the ear, clean out and make sure there's no fluid behind and inside the ear. That helps to reduce infection, viral or bacteria, and also symptoms as well and need for antibiotic therapy. It lessens the severity of the otitis media. If that ever occurs, it can go ahead and be cleared out with an antibiotic. So that is the overall explanation for does bottle feeding cause ear infection or otitis media in infants. Okay, so you are welcome to visit other videos, questions and answers that I have. Also visit other videos about eye, ears, nose, and throat infections as well. If you have any questions or comments, please leave those for me as well. I'll be happy to get back with you. If you have topic suggestions, do that as well. I have also a website that you can visit. Please subscribe as well, like, and share. Thank you for joining me for questioning and answering. I hope this was helpful. Have a great day. Bye-bye.